Hey guys, welcome. Here we are treating a lovely patient that unfortunately suffers from significant TMJ issues, has some trigger points up in her traps, clenches, grinds, chronic migraine patient. So we like to stay really consistent with her treatment to give her the most relief possible. So we treat with neurotoxin in her temporalis and masseter, of course, and then also cosmetically and, a little bit therapeutically in her frontalis, glabella, things like that. But here we are doing her trigger point injection. So you can see here, I have a syringe. It has not only neurotoxin, but also lidocaine. I am isolating the muscle. She is very comfortable. You can see here, you can't see her face, but she's definitely very comfortable, barely feeling this because of the lidocaine. And I'm going in and out of that trigger point. A trigger point is like a big ball of muscle fibers that are kind of angry, intertwined very tightly. So I'm going in and breaking this up. You can see here I'm never going full needle depth to remain safe. And I'm just kind of going in and out. The muscle in that area, the trigger point, is going to feel really tight like styrofoam. As I work through it and break it up with my needle and then inject that lidocaine and neurotoxin solution, it's going to break up very nicely. The neurotoxin is going to keep it calm for a long duration, and we will always reassess this area and make sure that she doesn't need more neurotoxin or retreated. It does take some time to figure out that perfect dose, but she has had really, really nice results. Following this procedure, we just ask that the patient doesn't do any strenuous activity, really tries to stay hydrated. They can take Tylenol if they need to for some pain relief. But generally, this procedure is tolerated really, really well. Again, other side, you can see I'm really isolating that muscle. You can see the drag on my needle, and then it kind of releases. So really breaking up that trigger point, that ball of muscle fibers that's causing her quite a bit of tension and tightness in her traps. If you come out, it's okay. You just go right back in and you can start working. When I assess, these are the areas that I found the trigger points to be most significant. And I assess that by just putting, quite a bit of pressure for about 6 to 10 seconds and to see what that elicits, what type of reaction that elicits, and if that's where the pain is in the patient. You can see here, double checking, making sure I like where I'm going. Again, I cautiously inject at this angle. You can see I'm not going full needle depth. Really, really just trying to stay safe. And the reason is because the lungs do come up higher than you may think, and we don't want to cause any issues. Patient tolerated this procedure really well, and we will follow her closely over the next couple weeks and make sure that she has had relief. Thanks for stopping by.